Today, we're shining a spotlight on a topic often overshadowed by silence: colon cancer. Aptly known as the silent killer, this disease can quietly develop without showing any symptoms until it's too late. Did you know that over 100,000 new cases of colon cancer are reported each year in the U.S.? Shocking, isn't it? It's the third most common cancer in both men and women, tragically claiming nearly 50,000 lives annually. Within the depths of our large intestine, cells can turn rogue and multiply uncontrollably, leading to colon cancer. While we can't predict its arrival with certainty, there are early warning signs that should never be ignored. Some of these signs may be subtle, while others may be more obvious. So, without further ado, let's delve into the core of the matter. Join us as we uncover the 9 early signs of colon cancer that demand your attention. Remember, early detection is key to winning this battle. Let's get started. Number 1. Changes in bowel habits. Colon cancer is typically more common among individuals around the age of 60. However, it's important to note that while half of the diagnosed cases occur in individuals over 65, younger people are not exempt from this disease. Paying attention to your bowel habits can serve as an early indicator of colon cancer. In a healthy colon, regular bowel movements occur approximately once every day or two. Stool should be soft, brown, and easy to pass without any presence of blood. If you observe any changes in your bathroom frequency or if your stool becomes hard and difficult to pass, it's essential to address these concerns as they may be signs worth investigating. Number 2. Constipation. The role of the colon in waste elimination is widely known, but it also plays a crucial part in absorbing water and nutrients from the food we consume. However, there are instances where the colon becomes obstructed, impeding its proper functioning. This can result in an uncomfortable and sometimes embarrassing condition known as constipation. While constipation may initially appear insignificant, it can actually serve as an early warning sign of colon cancer. Astonishingly, a study revealed that over 80% of individuals diagnosed with colon cancer had experienced constipation prior to their diagnosis. Several factors can contribute to constipation, including medication side effects and a sedentary lifestyle. Distinguishing between normal constipation and a more serious condition like colon cancer can be challenging. If you find yourself dealing with constipation lasting longer than 3 days, it's crucial to consult your doctor, especially if accompanied by other symptoms such as bloody stools and abdominal pain. If you're finding our video informative so far, make sure to show your support by liking it and subscribing to our channel. This way, you'll always stay updated on our latest informative content. Number 3. Diarrhea. Colon cancer often presents itself with the issue of diarrhea or loose bowel movements. Technically, diarrhea is defined as the occurrence of 3 or more unformed stools within a span of 24 hours. It's worth noting that diarrhea can also be a symptom of various other conditions, such as irritable bowel syndrome, lactose intolerance, and inflammatory bowel disease. According to the National Cancer Institute, certain individuals may experience diarrhea due to bacterial or parasitic infections in their colons. Number 4. Bleeding from the rectum. The occurrence of rectal bleeding could potentially indicate the presence of colon cancer. The rectum, constituting the final segment of the large intestine measuring approximately 5 inches in length, serves as the passage through which waste exits the body. However, it's worth noting that rectal bleeding is relatively common, and the majority of individuals experiencing this symptom do not have colon cancer. Hemorrhoids and anal fissures are among the alternative conditions that can lead to bleeding in this region. Additionally, bleeding from the rectum might be attributable to the presence of a polyp or other abnormal growth on the surface of the colon. Number 5. Blood in your stool. When detected early, colon cancer stands as one of the most treatable forms of cancer. The 5-year survival rate for colon cancer reaches an impressive 95%. Regrettably, approximately 1 in 20 Americans will encounter colon cancer at some point in their lives. Early detection significantly elevates the chances of survival. An early warning sign of colon cancer can be the presence of blood in the stool. The colon, responsible for storing stool before elimination, can exhibit bloody stools due to various factors, including different types of cancer, ulcerative colitis, diverticulitis, and hemorrhoids. Typically, blood in the stool arises from inflammation or injury within the large intestine. In some cases, bleeding may occur from other segments of the digestive tract, such as stomach ulcers. It's important to note that certain medications, such as antibiotics like ciprofloxacin, antidiarrheal drugs like lactulose, or iron supplements, can also cause a bloody stool. Number 6. Feeling constantly tired. The onset of symptoms related to colon cancer is typically gradual, with no specific early warning signs. Fatigue is a common occurrence and can be attributed to various factors, such as staying up late or inadequate sleep. However, if you experience persistent fatigue that persists even after sufficient rest, it could indicate an underlying issue in your body. The colon plays a vital role in eliminating waste through stool. When this process encounters blockages or slows down, it can result in the accumulation of toxins within the digestive system. Prolonged exposure to such conditions can eventually lead to the development of cancerous growths in the colon's lining. If you frequently experience fatigue and observe additional symptoms like bloating or abdominal discomfort, it may serve as an early indication of colon cancer. Number 7. Unexplained bloating or abdominal pain. Colon cancer can arise from a combination of genetic factors and lifestyle choices, such as dietary preferences and exercise routines, which can elevate the risk by up to 30%. Approximately 10 to 15% of colon cancer cases can be attributed to genetics, while other factors like unhealthy eating habits, obesity, smoking, and alcohol consumption contribute to a 5 to 10% increase in risk. Among the most prevalent symptoms associated with colon cancer is bloating, which can manifest in the early stages of the disease or may even stem from unrelated conditions. Bloating is characterized by a sensation of fullness or abdominal swelling, often caused by the presence of excess gas. Certain foods or medications can also induce bloating. If you find that your abdomen feels distended after meals, consider opting for smaller, more frequent portions throughout the day instead of consuming 3 large meals. This approach can help prevent overeating-induced bloating and contribute to better blood sugar regulation. Number 8. Sudden weight loss. The symptoms of colon cancer can differ depending on the location and stage of the tumor. One potential early indication of colon cancer is sudden weight loss, which can also be associated with other gastrointestinal conditions. However, it's important to note that weight loss can occur for various reasons, particularly in older adults who have recently recovered from an illness. In such cases, it is typically a normal occurrence to shed some extra pounds. Nonetheless, if you have experienced a weight loss of over 10 or 15 pounds within several months, it could potentially be a sign of colon cancer. Number 9. Feeling full all the time. While a healthy diet can contribute to lowering the risk of colon cancer, it may not be sufficient for complete prevention. Exercise also plays a crucial role. If you experience a feeling of fullness even without consuming food, it could indicate an issue with your digestive tract. Colon cancer can lead to bloating, constipation, diarrhea, and other digestive problems that interfere with normal eating patterns. Initially, these symptoms are often mild and easier to overlook compared to other signs of colon cancer. Consequently, if you also have symptoms like weight loss or fatigue, you might attribute them to different causes and delay seeking treatment. Regardless of whether you're 61 or 16, the most effective preventive measures against colon cancer involve maintaining a healthy diet, engaging in regular exercise, and maintaining a normal weight. These practices contribute to maintaining a clean colon. If you have a first-degree relative who had colorectal cancer before the age of 55, your risk of developing the disease is higher than average. Having 2 first-degree relatives with colorectal cancer before age 55 further increases your risk. African Americans face a higher risk of colon cancer compared to other racial and ethnic groups in the U.S., although this disparity may be attributed to variations in access to screening tests rather than biological factors alone. Remember, if you observe any of the aforementioned symptoms, it is important not to delay contacting your doctor. It is crucial to note that these symptoms may serve as early signs of colon cancer, although they are not definitive indicators. Moreover, if you possess any of the aforementioned risk factors for colon cancer, it is important to discuss with your doctor whether colonoscopies would be the most appropriate screening option. Thank you for watching our video on colon cancer early warning signs. If you found the information valuable, don't forget to give this video a thumbs up and subscribe to our channel for more insightful content. Now, we have an exciting opportunity for you. Click on the next video to discover the amazing 5 health benefits of pomegranate. You'll be amazed by the surprising benefits this fruit offers for your well-being. But before you go, we want to hear from you. In the comments section below, share your thoughts on colon cancer awareness and let us know if you've ever encountered any of the early warning signs discussed in this video. We're eager to engage with our viewers and hear your experiences. Remember, early detection saves lives. Stay informed, take care of your health, and together let's spread awareness about colon cancer. Thank you for being a part of our community, and we'll see you in the next video.